Good morning. Welcome to the weekly COVID-19 media update. I'm Carrie Schutte, the Public Information Officer. We'll start with the statistics, and as of October 6th, we have 1,242 confirmed cases of COVID-19, including 84 from Monday. We have done a total of 50,814 tests. We have 9 people hospitalized in Shasta County, including none in the intensive care unit. We have 105 people in isolation. Those are people who have tested positive. And we have another 286 in quarantine. Those are the people who have been in close contact with people who have tested positive. As a disclaimer, those numbers are probably on the low side because it is taking some time to reach out to all of this large volume of cases that we've had in recent days. And so those numbers will increase as we're able to reach out to more folks. We have had 22 deaths at this time. We have dropped into the red tier as of yesterday after Tuesday's statewide data update. That is in large part due to our case rate, which has increased to 12.8 daily cases per 100,000 residents. That actually is in the purple zone, but you need to be in a tier for 2 weeks before we would increase to the next one. So we are in the red right now. Our positivity rate is at 6.9%, which is in the red. Those numbers are a 7-day average with a 7-day lag. So that's the week of September 20th through the 26th. Shasta will need to move into the red category by Friday. And what that means is all listed on shastaready.org. If you click on Roadmap to Recovery, you'll see a chart that shows which businesses need to adopt which restrictions as of Friday as we move from the orange into the red. And those are my introductory comments. And I think I'll introduce everyone who's here with us today. We have Robin Schurig, the director of the Public Health Branch of the Health and Human Services Agency. Donnell Ewert is our director of the Health and Human Services Agency. Matt Pontes is the CEO of Shasta County. Dr. Karen Ramstrom is our county health officer. Dean Germano is the director of the Shasta Community Health Center. Mark Mitchelson is from Shasta Regional Medical Center. And then we have Glenn Hayward from Redding Rancheria. Does anyone have any introductory comments before we go to public media questions? All right, we are ready for your questions.
Hi, good morning. This is Anna here from Action News Now. This one is regarding kind of related to the Bethel infection that was announced at yesterday's Board of Supervisors meeting. So I know Dr. Ramstrom, you mentioned that there's over 100 cases linked with Bethel. Now, are these students and staff, are they from out of the area or are they from here within Redding?
Thank you. So as you know, many of these students do come from out of the area. And so it sounds like some individuals were tested before, and BSSM had a process in place where they were quarantining new arrivals for a 2-week period. And then after being here for a bit, some individuals tested positive subsequent to their arrival. So it's hard to say if they arrived with it or if they acquired it here or some combination of that. And much of that transmission we've seen in shared housing, so it's probably a combination of the two.
Thank you for that. And to follow up on that, public health has always kind of mentioned in the past they've discouraged activities that were non-essential, traveling, unless needed to. Yet Bethel kind of brought in those foreign exchange international students or out-of-town students into that area. What does public health have to say about that?
So I think that's a situation that all colleges and universities nationwide are dealing with, because students come from all over to those settings. And so these institutions have plans, just like Simpson has a plan, Shasta College has a plan, and BSSM has a plan. And part of the plan for BSSM is to limit the movement of those individuals upon their arrival, and they also implemented testing of those individuals. And so those are some practices that are used in college and university settings because they do bring people in from other communities, as you're describing.
Thank you, Dr. Manson. I'm just gonna, sorry, keep following up on some questions till someone's ready to jump in. Would you consider these activities that Bethel is having, would you consider them as being defiant?
So, you know, I think college settings in general are really challenging because these are generally younger people and they're coming to a new setting and getting to know each other. You know, they're young adults, they are adults, but they, you know, it's not unusual in those settings to have individuals who want to socialize. And so I think that BSSM is setting up some new practices, having gone through this experience, and will be communicating expectations to their students and engaging them in solutions. You know, I would encourage you to inquire with them about what those kinds of new practices will look like and their expectations of their students to protect one another and their community.
And to kind of follow up on that, how, you know, I understand public health and BSSM are working together. How are you guys handling these cases to make sure that, you know, it doesn't grow? We're already seeing over 100 cases linked to them.
Right. So we have been working with not only these higher education settings, but also K through 12, and had worked all summer to get protocols in place and have been having regular conversations. And so we're using some similar practices for K through 12 and these higher education settings where we have protocols and procedures in place for information sharing on cases and sort of distribution of the workload for contact tracing and setting up processes where our staff are communicating closely with designated staff in those institutions about cases and contact tracing and any sort of action that needs to be taken in terms of restricting or identifying individuals who need to be sent home for either isolation or quarantine. So we're doing something similar with Bethel, just like we're doing with the other school settings.
And just want to make sure, like you mentioned, does BSSM also have like their own COVID liaison like other school districts have right now?
They do, and they have, I realize like many of the schools, it's a lot of work. And so they have actually already added an additional person to have 2 people available to do that work for their schools.
And the individuals who are, you know, tested positive, are they currently right now isolated and quarantined in their respective areas?
So cases at BSSM are treated like cases anywhere. So yeah, so they would be isolated.
There, could you all hear? Can you hear me?
Yeah.
Okay, good. I was having trouble with my microphone again. I'm screaming into the microphone and nothing's happening. For Dr. Ramstrom, going off of that article last week from Bloomberg, are you concerned? How concerned are you for your personal safety?
Oh, Mike, I knew you would ask me that. I should have prepared better. So I think I'm concerned just from a realistic perspective. You know, all of us. You know, I think I'm not terribly concerned for my safety, but I am, you know, taking steps like anybody would just to be careful. And I'm really fortunate to have a lot of support in our leadership within our agency and at the county, and that feels that helps. It helps a lot. And you know, people have the right to express their opinions, and my hope is that we can move to a place where we're having more exchange of constructive information and be in it together against this virus, because that's what our enemy is a virus. It's not each other. And so I'm hopeful we can move to where we are having more positive communication in that regard. And I think people are venting to a large degree, is my hope, and they have the right to do that. This is not easy for anybody, and certainly civil unrest or violence isn't going to help us to address this pandemic. And so my hope is that we can come together more than be disparate in our viewpoints in the way that we're addressing this situation.
Thank you, Doctor. For Matt Pontus, I won't ask you about your socks, but I will ask you, did you have someone from the county cut down her bushes? Did you ask police to make extra patrols of her home?
So we haven't done any landscaping over at Karen's place, although I personally would volunteer to go over there and help her out on my own time if she needed some help. So that's always out there, Karen, in case you need some extra weeds pulled or lawn trim. But no, Mike, and you know, in terms of patrols, yeah, there was an ask just to make sure that we have some extra patrols downtown and at various facilities, but we're not going to go through a whole bunch of details on security protocols.
Understand. Thank you, Matt. I just wanted to see if that you know, how true that report was. Now I have a question for Robin Schurig. Robin, first, welcome to your new position. And I wanted to ask you, you kind of you did talk a little bit yesterday at the supervisors meeting about the possibility of Shasta County moving into the purple range. How likely, how realistic is that? How concerned should we be?
I think it's pretty likely. The data that determines what tier we move into is delayed, so it's a week old. And the reason that they do that is they want to wait and make sure that the data is complete before they use it to assign us to a tier. And so because of that, you know, we're already kind of able to see what the data for next week is going to look like because it's really this week's data. So I think it's pretty likely. I would like to be hopeful and say maybe we'll stay in the red for a while because that way it'll be easier for us to get back to the orange quicker. But realistically, I don't think that's very likely. I think we probably will be moving into the purple 2 weeks from now.
Thank you very much. Discouraging, but thank you.
Hi, to follow up on that, bouncing off of Mike's question, Robin, this one is for you or Dr. Ramstrom or for whoever. Is it frustrating to see us move possibly into a more restrictive tier? We were in the orange for quite a while, and then now we're in the red, and to hear that we're about to possibly move into the purple, just want to get public health's take on that.
Sure. So yeah, I mean, I think it is frustrating, you know, but at the same time, it's a in our community right now. And, you know, as I mentioned at the board meeting yesterday, the intention behind this system that the state has put in place is really to, you know, put some restrictions on a county when their numbers are going up in order to kind of contain that and get those numbers to go back down. So while it's unfortunate that some businesses have to, you know, reduce the amount of service they can provide and some may need to close altogether, the purpose behind that is to encourage people to really stay at home more and just be cautious and not be spreading disease. So I think it will benefit us and we will be able to move back to the orange eventually. It will just take a while if we're going to move all the way into the purple first.
And I think I'll just add to that too, that it seems like, you know, our county, we seem to lag behind some other parts of the state and how what we've experienced in our county. And so this is, I think, bound to happen at some point. Just, you know, we're experiencing what other counties have experienced, you know, 4 or 6 weeks earlier. And so even if you just look at Butte County, Tehama County is having challenges too. And so we're hopeful that, as Robin described, the restrictions sort of that are progressively go up with each tier are going to help us to get this you know, contained so that we can kind of go back again to a less restrictive tier. And that's what they're designed to do. And we've seen it work. We've seen it work in other counties very recently. I think Butte County is probably the most recent really clear example, and they were able to go back down.
So it was kind of just a matter of like when it was going to happen. Like it was kind of bound to happen eventually that we could have been pushed into a restrictive tier.
Yeah, I think we were anticipating it. hoping we could just kind of trickle along like we were, but I'm not surprised.
Doctor, I'll go ahead, Anna, or were you not done?
No, sorry. You can go ahead.
Dr. Ramstrom, yesterday in the board meeting, you mentioned that another nursing facility besides Windsor may be on the verge of an outbreak. Is there any more information on that? And is there any discussion about tightening the procedure for preventing outbreaks at those facilities, like that being such a medically vulnerable population? Are there additional restrictions placed on the healthcare workers?
So these facilities have had guidelines since the beginning of the outbreak, and so they're implementing those. Those include regular testing of staff, and then when they have a case, they also start doing regular testing of residents. And so there's a number of practices that are outlined in state letters to these facilities that they will be implementing. We've been in communication with them daily, our staff, and I'm going to be visiting them today. And so we've had these situations where we've had a facility have a few cases, and then they implement the practices and are able to get it under control. And so we are supporting them, and if they have needs for personal protective equipment or staffing or anything like that, that's really our role with supporting them. And just going in and being an extra set of eyes to give them some additional input and suggestions. And so that's what we'll be doing, like we've done with other facilities. And we're hopeful that will be effective, but we'll be in close contact and available to them and supporting them until that's the case.
How did it go so haywire at Windsor? Did they fail to follow those procedures? How did it get so out of hand there?
So I think, this is not this experience has happened statewide. It's a good question of why Windsor specifically. I think it's not unique. I think there's challenges with exposures in the community, and they come into and they get into the facility. And if you have staff turnover and the need for training, and I don't think that there's any one thing. And I would also direct you to them. You could ask them that question and what their perspective is. And looking back, once we get through this, we'll probably have additional information that will shed light on that question.
Hi there, this is Matt Brandon from the Record Searchlight. I know that Dr. Ramstrom, you brought up Bethel yesterday being tied to, I believe you said 123 cases in the last 2 weeks. I wondered if we know how many cases have been tied to Bethel since the beginning of the pandemic.
We do. Robin, did you see that figure today? I think we have that. I don't have it off the top of my head.
I don't either. And I would just clarify too that the numbers that were reported yesterday were specifically associated with Bethel School of Supernatural Ministry. So if you're asking about Bethel as a whole, we don't know overall how many cases have been connected there, but we've been tracking the numbers connected to the school because of the high number of cases that have been connected there. I don't think it's much higher though than 123 because their classes just started within the last few weeks. I don't think there were very many like over the summer or anything.
Okay, and then I was also wondering, do you know how many total nursing home cases there are in the county? Because I know that dashboard the state has sometimes will not have a exact number.
We do. We keep track of that. I don't have it right in front of me right now, but we kind of keep track of what the most recent cases, and we actually have a standing meeting internally where we talk about that, the number of facilities that might have a case or two, whether it's in the staff. Typically it's 1 or 2 staff people. And so I think I shared yesterday that we're tracking right now about 9 facilities, which is not unusual. And they go into what's called response testing, where they're doing more testing so that they can identify like asymptomatic individuals that might be sources. So I'm sorry, I don't have the total number right in front of me right now.
Okay, that's all right. Do we know what the total number of cases would be just for the Windsor care home right now, and the total number of deaths that have been connected to the center?
So my understanding is that just from a call this morning, that the facility is updating information with the state. What is currently available on the state dashboard apparently is incorrect information. I'm aware of 60 residents and 20 staff. Those are the latest figures I've seen that have tested positive in the course of this outbreak. And the deaths, we don't report them until we see death certificates, so we'll see what the facility ends up reporting on that dashboard.
Okay, so we don't, the county doesn't really currently know how many deaths are connected to Windsor care home?
We know what they've shared with us, but again, as far as what we report in our numbers, we wait and we review death certificates.
Have any of the deaths that we have reported, because I believe it's 22 at this point, have any of the, can we say for sure if any of those have been connected to it?
They have. They have.
Could it be 1 or 2 or 3? Do we have an exact number?
I believe, I think it was 7.
Okay, so 7 deaths have been connected to that one Reading Windsor care home alone.
In our reported numbers.
Okay, and are all those residents, or how many of those are staff?
Oh, they're residents. And I have to go back and double check, but I believe it's been 7. Carrie, you might know the ones that I've sent to you.
Yeah, I'm not sure, but we can double check and get back. Really, the best way to track that, Matt, is on that state website.
Okay, and stepping into a different topic real quick. Oh, one more thing about the nursing home is I know you guys are working with the state to, try to limit those outbreaks. Can you tell us what specifically the state is able to do, and what working with the state really means for people who just see that and don't know what it might mean?
Sure. So we're working with a couple different departments of the California Department of Public Health. Their licensing and certification office in Sacramento, as well as their district office in Chico. We've been working with both of them. They actually go into these facilities and do regular assessments to make sure that they meet certain standards. And so that's one entity that we've been involved in regular discussions. Another entity at the state is their healthcare associated infections area, where they have expertise in infection control, these prevention practices we've been talking about that are required and recommended by the state. And so those are 2 at the state office. And the kinds of conversations we have involve staffing, what that's looking like. Do they need support for staffing? Do they have so many staff out that they need us to help request additional staff? And there's a process that we go through where we request staff regionally. And if we need to, we send it up to the state, and the state has been able to help secure resources in terms of staffing. So those are some examples. The Healthcare Associated Infections team has been in the facility. They've written a detailed report with recommendations for the facility about how they can improve their practices. We have daily phone calls with them. We talk to them about their supply PPE, make sure that supply chain is good. We talk to them about fit testing and whether they have supplies for that. And we talk about best practices that have been identified that the facility can be implementing to help their situation. So those are some examples of the conversations we have when we're on the phone with the state and with the facility and their corporate leadership.
Gotcha. Thank you for that answer. And then I also wanted to ask, last time we had earlier in the spring, around May, when businesses were shutting down or had some shutdowns and reopens, there was some, a lot of business owners were hurt by these shutdowns, but a lot of people also said that there wasn't enough enforcement for businesses that were flouting restrictions and still operating. Will anything, as we have some businesses changing their operations with going into the red and possibly the purple later down the line, will anything change in terms of stricter enforcement for making sure businesses are in compliance?
So I think the state is doing more enforcement now than they were back then. The state entities like ABC or Cal OSHA are going out to businesses to do education and in some cases enforcement. They're following up on complaints, but they're also just doing their sort of routine inspections of businesses now, more so than they were in the past. We receive reports. We don't get specifics of which businesses they've visited, but we get numbers of how many businesses in our county they visited. And so those entities are here every week doing their work around enforcement as well as education.
In addition to those state entities, will we also have our local law enforcement doing that sort of work, or will that all be left up to the state?
So that's not necessarily work that our law enforcement would be doing. We do have a business engagement team within our Department Operations Center that does reach out to businesses either in response to complaints or sometimes in response to requests from businesses if they're reaching out to us with questions or requests for support on what are the restrictions and how can they go about making sure that they're following those. And so we do engage. We do have staff who engage directly with businesses around that, but it doesn't involve law enforcement.
Gotcha. Okay. And then I also wanted to ask, there's a company, Paradigm, that I believe is working testing vaccines in the area. Are you guys in contact with them or required to be in contact with them and work with them, the county?
Be happy to answer that. We are aware of some of the work Paradigm is doing because they've shared that with us. They are a private business. They're not at all connected to the county of Shasta. So they have made deals with or applied and been accepted to participate in 2 of the vaccine trials that are going on around the country. Just keep in mind that things are being done in multiple places. So the number of participants from Shasta County is very small, or very small parts of the larger study. They are seeking out volunteers to participate in those trials. And again, that's being done by them independently of the county. We just had some information shared back and forth. I can say that it's a double-blind, randomized, controlled trial, which basically means that the participants are assigned to groups, either a vaccine or placebo, and neither the participant or the person that administrates the syringe or whatever to the person knows which group they're in. So they are blinded. There's some rumors going around that then they're somehow exposed to COVID after they've received these medications. That is absolutely false. That is unethical, and that hasn't been done since the 19th century, as far as I know. But the idea here is that you have a group that's been vaccinated and another group that has not, and they're going about their business in the community, and you see if any of them get COVID. Just going about their normal business. And keep in mind, that these trials have 3 phases. The first phase, the safety trial, is the vaccine safe in humans. The second phase is, does it produce an immune response? Does the person produce antibodies? The third phase is what's going on now, and the third phase is all that's happened in Reading. Third phase is basically to see if the vaccine is efficacious. So just because there's an immune response produced by the vaccine doesn't mean it actually is better than placebo. So they're basically comparing the attack rate of COVID in the placebo group versus the vaccinated group.
Well, before the poor gal doing the sign language's arms get too tired, I wanted to ask Dean Germano about the point of care testing. How important is that? Where are we with that?
Yeah, thanks, Mike. Point of care testing essentially is the ability to test a patient and get a result in a short amount of time, typically in 15 minutes. We on the outpatient side of things have been disadvantaged by the fact that the product has not been available to us, and hence we've been going strictly on the basis of symptoms in terms of letting people into our building, patients, treating them, so on and so forth. That seemed to change this past week. We had both BD and Abbott provide us with quite a bit of product, and now we're putting into place our systems in terms of using that in our screening and in our verification. But if anything we've learned from what happened at the White House is an over-reliance on same-day testing. One, because it's not 100% accurate, although it's really quite high. But two, it's a moment in time, and that tests. So you could be negative today but positive tomorrow. But in terms of our ability to better take care of patients and have our staff feel safe about treating patients, it's a game changer for us. And I'm assuming that is starting to happen throughout the country and in our region. So I think that's a real positive development in terms of the medical community.
Thank you, Dean.
Any other questions?
For the flu vaccination clinic this Saturday, will there be any additional precautions in place to prevent the spread of COVID, and will testing be available at that event?
Testing will not be available at that event, but yes, there will be additional precautions in place, including requiring the attendees to wear masks, as well as obviously the staff will be wearing masks as well.
And that is from 9:30 a.m. to 2 p.m. at 2650 Breslau Way. Other questions? Looks like, Matt, you had a...
Yeah, I just had one or two real quick ones. I wondered, with us going into the red, I know that schools are still open, but we've had questions from parents about high school sports. Do we have any idea when how going into the red affects that, and when we think kids might be able to participate in high school sports?
So the tier system is not tied to schools in any way in terms of schools being able to stay open versus go to distance learning. So put that out there, that those are two completely separate things. It's really up to the school superintendents to determine when or whether they want to switch to distance learning based on cases that they have in their schools. But as far as youth sports, that also is not tied to the tier system, but I don't know, Karen, if you've heard anything from the state about when that might be allowed to start happening.
Karen, you're muted.
State guidance is going to be updated.
Can you say that one more time, Karen? You were on mute for...
Can you hear me now?
Oh. Yep.
Okay, sure. So we don't know about, we have sent an inquiry into the state to find out when and if that youth sports guidance is going to be updated, but we haven't heard back yet. But we understand where that question's coming from, and that the schools were asked to submit schedules in anticipation of state guidance coming. But as far as we're aware, it has not been produced yet. It hasn't been released, but it may be in the works. So we're waiting to hear.
Gotcha. Thank you for that. And my last question is just, as we are on track to go into the purple in 2 weeks, if nothing changes, if we go and if that does happen and we go into the purple and we're hitting the state restrictions, we're all in compliance, but we're still seeing spread. Could the county go a step further than that purple tier? What happens if when we're in that purple tier, the spread doesn't curtail, and if could more actions be taken?
So I don't think that any further actions would be taken by the state. I mean, at the time, we are allowed to put more restrictions in place at the local level if we were to choose to, but I don't anticipate that being the case. We haven't put any further restrictions in place so far beyond what the state has mandated. And so I think that would remain the case. We would just want to, increase our education efforts to try to get people to
distance and wear their mask and avoid gatherings and stay home when you're sick and all of the things that we've been saying for months.
We'd just like to follow up on Robin's comments and say that the purple tier is where a lot of counties have been around the state. Some are still there, and it is effective in reducing transmission and reducing the case rate and the testing positivity rate. So counties do progress from the purple back to red. That's happening around the state. It happened in Butte County yesterday. So I'm confident that we are going to be able to control these situations and get back to a lower incidence. I would like to just mention also, just from a big picture point of view, that this really is our third spike in Shasta County. You know, our first spike was at the very beginning there around the very end of March when the COVID was first sort of happening. Second one was over the summer after businesses began opening back as allowed by the state in May. We started to see an increase in cases, and then the state put the dimmer switch on in July and the case rate went down. And then in early September, they put the tier system in place, and we had more openings of our businesses, and all of our schools went back, and our institutes of higher education opened. And so what we're seeing now is really a third spike based on that opening. So each time there's been an opening, there's been an increase in cases. And I think what we're still trying to find is the right balance. You know, we do want to control the outbreaks, but we also don't want to do collateral damage to our local economy and people's well-being. And so it's trying to find that balance. I think if you go back and you look at the incidence numbers or the rates in Shasta County and the death rate in Shasta County versus other parts of California, you'll find that our rates have been lower, much lower on average. Which what that means, I mean, it's great. You know, we've been able to control a lot of the situations that have developed. Dr. Ramstrom, Robin Schurig, their team, they've been able to do a lot of good work in a lot of institutions where there's been cases, and we've been able to control those before they got out of control. You know, Windsor is one situation that kind of got away, and I think one analogy that makes sense is looking at the fires. You know, we had a lot of fires in California. We didn't have any in Shasta County, and then we had a really windy day, and that Zog thing got started, and that was just too much. You know, that our county fire department did a great job tamping down a lot of other fires, but that one got away, and you know, that's akin to what happens sometimes with communicable diseases, but it does get under control. We've applied a lot of work to them, and it's going to turn around. But I think everyone's got to do their part. We can't do it alone. We need the whole community to participate. We need the businesses to comply with the regulations as it applies to the red tier. We need all of our community members to continue to refrain from gathering, to stay home when they're sick, and wear masks. Masks are very effective, and we need that to continue. And I think that we will see a change, but these kind of situations with nursing homes and universities have happened all over California and the country, and it is not unusual what we're seeing. But we do all need to work together to change our situation. It's really in our control.
Gotcha. Thank you.
Before you go, I just want to thank you folks for doing a difficult job that when you were hired, this job wasn't nearly as difficult as it's become, and I think you've really stepped up. I commend you.
Likewise, difficult on a number of different levels as well.
Thank you,
Yeah,
Steve, for
agreed.
saying that. Really nice of you. We appreciate it. Any other media questions?
Yeah, sorry, I just
All right.
wanted to follow up. Sorry.
Yes.
Sorry. Just kind of wanted to, I just had a few more questions I wanted to follow up on before I let you guys go. This one's for Robin. There's no timeline as to how long we could stay in the red, but I guess in your perspective, in your opinion, how long could we expect to stay in these restricted tiers?
So we have to be in the red for 2 weeks before they can move us to a more restrictive tier. And so I anticipate that's likely to happen, is we'll be in the red for 2 weeks and then we'll move into the purple. Once we're there, we have to be in the purple for at least 3 weeks before we could move back to the less restrictive red tier. And it just depends on what our data does. So it's really impossible to predict whether those numbers are going to go down and we'll be able to move back the end of that 3-week period or if we'll stay there longer. So I wish I had a crystal ball, but I don't.
That's fine. Thank you for that. Just wanted to follow up. Sorry, I realized I had a little more about regarding the Bethel situation. Kind of going back there, Dr. Ramstrom, what do we know about these individuals who are infected? Is it still the same college young adult group that we've been seeing the last couple of weeks?
So what we were talking about is the Bethel School of Supernatural Ministry, their students. There's I believe that there's been a handful of staff too that serve those students, but or teach those students, but it's not Bethel at large. It's the school, it's the SSM. So that's that college age group primarily.
Right. Thank you for that clarification. And I think that kind of covers it on my end.
All right, great. Thank you, Anna. Are there any other questions? Okay. Thank you, everyone, for joining us today. Everyone stay safe and healthy. Have a great day.
Thank you, everybody.